So several times my students ask me to do a case study, and I never went really into it because it takes just time. You know, when you have an online school and you record courses and you have an ongoing clinic and you have a team and there's just so much going on that every minute when I work counts. And you can't even believe it. My schedule is so tight that really every minute of my schedule I have something to do. And there are so many things I want to do, but I need, step by step, as I always say. So, but I said to myself, I will try to keep once a week, twice a week to do a case study. So we can talk about a patient who came into my clinic and how I was treating it and what I was using. And I totally get it by my students that they're right. It is really important. You can't just talk and talk and talk and teach and teach and teach and not really go into a case study. And yeah, this is important because you can just learn so much out of it, okay? And on the comments people are giving often, also there we can have a discussion about it, okay? Because also my treatments are not always perfect and there are many things I can improve and or someone else would do different, which is totally fine, okay? Because we never ever have just one way to treat a patient where there are so many ways. Okay, so let's start case number 1. And we talk about a patient who had a feeling of a lump in her throat. Okay, she came into my clinic after she had already for 9 months a feeling of a lump in her throat. And she started 4 months before she came to me the diagnosis of Western medicine, and just they didn't found anything. They did ultrasound, they sent her to CT. She went, of course, to doctors who were checking her throat, who were looking inside and trying, and all kinds of things. They gave her all kinds of medications for reflux, and nothing worked, nothing helped. She was really desperate because it was annoying. She was trying, when she was swallowing, she was feeling it, but she was also just feeling it when she was laying down. And this uncomfortable feeling was there. And I have many patients like this coming into the clinic and don't have a solution from the Western part. What is very beautiful, nice today is that in the end, the doctor said to her, go to acupuncture, try this. And she came. She by herself is a social worker. She's working really hard. She started 2 years ago working as a social worker, and the weight of emotions on her shoulders is really high. And she started quite fast after she started working as a social worker, not sleeping well anymore, and she had trouble falling asleep. She was hearing her heart beating and feeling uncomfortable, and her thoughts didn't stop. And this heartbeat, she says, she was hearing it and it was disturbing her to fall asleep. And this is this tension, I guess you had probably once in your life or have heard about it, which is making us really uncomfortable, and we can't really shut down, okay? And even if we fall asleep, we wake up suddenly and we're awake and look around and or immediately start thinking again, okay? And this is when the yin, the yang doesn't go really into the yin in the night, okay? It stays here and we don't calm ourselves down. And this is something really important we have to learn, okay? And we have to take care of that. The yang, after a certain hour in the day, we need to let it go down, okay? Not work until too late and not do things which are raising up the yang late in the evenings, okay? If it's sometimes happening, it's fine. It's not the end of the world, but we should try this, okay? And this is really important. That's why we should do quiet things in the evening, okay? Okay, so she went to all the doctors and they told her, and she understood that she's suffering from stress and she has anxiety, okay? And this anxiety is from the work she has, that she feels that she is probably not good enough still in what she does, that many people are disappointed in her work. Most of the people she's working with, not the employees in the section she's working, the people she tries to help as a social worker. And this was really hard on her. In the consultation meeting, she said that she has trouble sleeping since 2 years, since she started working as a social worker, where she takes care of people with mental disorders. Work has significant impact on her personal life, as we said. Feels that this type of work is too much for her. Yes, sometimes this happens, that we learn something and later on we just understand it's not so easy. Doesn't mean that she needs to quit. It means that she needs to do it differently, think differently, okay? And this is something we're still working with her on it. And when she goes to sleep, her head starts overthinking and she feels a heartbeat that disturbs her to find quietness in her mind. And sometimes she's suffering from dizziness, and when she gets up from a chair, general weakness, and soft stools she's suffering from. Predicted treatment. So what I'm doing in the consultation meeting with the patient, I hear their stories, and then I tell them what I think, how we will treat them, and what will be the way. So we told her that we will use needle acupuncture, laser acupuncture, and the breathing seminar of Neijing School. In the moment it's just in Hebrew. This will be changed in the future, that we have also an English one, okay? But this breathing seminar is helping the patients. It's a 20-minute seminar, very easy to do, but it gives us, the patients, the basic of breathing techniques which they can use through the whole process, and even when they get laid in our rooms with the needles, okay? Practitioners of treatment, Shimon and Mickey. Mickey is in charge of emotional treatments in our clinic. And we said that we first will strengthen her chi and blood and then concentrate on her heart and kidney, okay? And often we do this in the clinic. Normally I'm in charge of strengthening the chi and blood. This is to bring up the chi and blood, so there's a good basis. We can treat the rest of the meridians. If we don't do this often and we try immediately go to the heart and kidney, there's no substance, there's no base, okay? And you build something that collapses very fast. But if you build this basis very strong and good, these foundations, then the kidney and the heart have all the power and all the control to help the body to be balanced. Laser frequencies, Nuger A, F, and G, okay? There's on our school system, you can find a Nuger laser frequency course. So I'm not going into the frequencies now, but if you want to, start learning about it. And we use 1.5 joules on each point on 200 milliwatt. Amount of treatments every 2 to 4 days until there's some improvements, okay? And normally this happens after the third, fourth treatment, and then we go over to every 7 days to even once every 21 days. We try to see our patients as less as possible in the clinic, okay? Because a lump in the throat normally doesn't improve in a few days or a few weeks. It takes sometimes 2 to 3 months to disappear, okay? But normally after the first months already, there's a huge difference, and almost it's not anymore there, or sometimes it just appears. Treatment process. It was easy to notice that she was unwilling to connect or have any conversations. Yes, I remember this very well. She came into the room and she didn't really want to talk. I'm a person who likes to talk, to interact, and she was keeping it quiet, laying down, and was more like, Shimon, be quiet, don't talk to me, put the needles in and go. And we did this in the beginning. And I concentrated first on, I felt that her pulse was weak in the spleen and lung stages. The tongue was with a light white coating and a white thin coating, and the tongue body was also very thin. And we started I decided to start with a very simple technique I'm using often in these cases, is large intestine, 11 and 10, go to the other side, Dr. Tana, I love him, and use on the other side, I used in this case stomach 36 and 40, really simple. And on the other side, lung 5, lung 9, and then on the other leg, spleen 9 and 6. Really simple, not complicated. I could go deeper in more difficult points, more complicated points, or use other things there. I mean, there are really master dong points. I could use Dauma, but we sometimes keep it simple and it works. And breathing seminar we told her to do. At the second treatment, we continued the same treatment. We changed spleen 6 to liver 5. Why? Because her liver pulse started to be strong, and she reported of itchiness in the vulvar area, which happens often to her when she comes close to her period. Okay, so we just moved the spleen 6 to liver 5. That was the only thing we did, and it was a huge difference, and it stopped. Okay, the itchiness stopped afterwards. I don't see that she ever reported again that it's there, so amazing. Okay, I don't know if it was us, I guess yes, because itchiness always often has to do with the deficiency of blood. Okay, and because we strengthened her blood, the liver became calm without even touching the liver. Okay, I mean, there was triple bomb and gallbladder which are balancing out the liver, but this is one nice thing, that you can treat often a meridian without even touching it, because you calm down other meridians which are much more important in balancing out the treatment. Okay. At the fourth treatment, she reported that she has improvement in the weakness and felt much more energetic, and now had no dizziness. Let's add here no dizziness, and her sleep improved just a bit. Okay, she didn't sleep still well, but dizziness and energetic was better. So she changed her treatment. So we changed her treatment, and in this phase she moved to Miki for the emotional treatments. I stopped treating her, and Miki continued the treatments, and she did heart 3 and heart 7. Other side she did gallbladder. Other side she did kidney 7 and 3, and then she did on the other side triple warmer 5 and 8, and gallbladder 34 and 40. You can see it in the description in the text. Okay. We kept these meridians almost until the end with some adjustments of different points by her feeling on each treatment. So we keep often the same meridians, but we go on different points on the state of the patient when he comes into the room. Okay. Sometimes also there here we will change the meridians, but we try to keep the same meridians, but work with different points, because sometimes we are more warm, we're more cold, we're more weaker, we are stronger, and like this we move around the points through the treatments. Okay. After the sixth treatment, her lump in the throat was gone. Oh yeah. So okay, so this means probably that she was after 4 weeks of treatment. It was gone, and she did not feel the lump anymore. Her sleeping had improved. She was very open and had every day a conversation with us. Also this improved. You know, sometimes when we are deficient, we have no power to listen to anyone. We don't want to really talk. But then we gain energy, and suddenly it's possible for us to have a conversation and to talk and to stay concentrated. So yeah, I love acupuncture. These are the best treatments ever, and we have the ability to help so many people. So please, please, please treat your patients and do your job. Work, okay? Don't be afraid of it. We're here to encourage you, and if you have any questions or need any help, we have also the coaching program of Practicum. You can look it up at our page, and we can meet you on one-on-one meetings where we will help you from A to Z in all the treatments and everything, okay? So feel free to contact us.